Welcome to DocTalks, Understanding Lab Medicine. My name is Jeff Malmgren. I work for the Burnaby Primary Care Networks, which sponsors the DocTalks. This one in particular will be of particular interest. It looks at just exactly how the labs work and how lab medicine works and how you can better connect and understand lab medicine as you go forward. This particular DocTalk is actually a partnership with a SharedCare project, which has been being undertaken by the Burnaby Division of Family Practice. SharedCare is an initiative that looks at ways that we can better share care across family doctors and specialists, across family doctors and specialists in the community, and also across folks like LifeLabs. And we're very fortunate today to have Dr. Segal and Kathy Glassie from LifeLabs who will be presenting. Just a couple things before we get started. This session is being recorded, just so everybody's aware, and it will be made available after the session on the burnabpcn.ca website. So if you want to see it again, or if you have others you'd like to share it with, you can always look there. As well, the other DocTalks that have been made over the last couple of years are also available. You may find them of interest. And that website does carry a number of different resources for folks in the community around both social supports and clinical medical supports and primary care in Burnaby. Just some housekeeping items. We'll have a couple of presentations. We won't take questions during the presentation, but we hope to have some time afterward to answer some of your questions if they come up. What we'd ask you to do is please enter the questions into the Q&A piece on the webinar. You could put them in the chat, but we might lose them. But if you put them in the Q&A, we guarantee that we'll get them. And if we do have questions in the Q&A, but we run out of time, we'll make sure that we round back and we drop them in when we post the session on the burnabpcn.ca website. So I do, again, we'll have a couple of presentations. We'll start with Kathy Glassie. I wanted to introduce Kathy. She's been working in the lab field since 1982. She trained as a medical laboratory assistant, and she went on to work at various patient service centers for LifeLabs over the last 26 years, taking blood, performing ECGs, testing samples, preparing specimens for transport to the lab for testing. She began working in the resource department, a team of employees who work with LifeLabs doctors and testing benches to answer tough questions for the employees in those service centers when they need the answers. And she began working in client services department to support doctors, MOAs, and patients with questions, concerns, and issues. So you can see Kathy has a tremendously deep understanding of the system from a LifeLabs point of view and has looked at it from almost every angle. We're so glad to have Kathy with us. And Dr. Segal, he joined LifeLabs from the University of Texas Science Center in Houston. He's board certified in both clinical pathology and family medicine. At UT Houston, Dr. Segal cared for patients at Memorial Hermann Hospital in the Texas Medical Center. He also served as assistant director of the family medicine clerkship at McGovern Medical School and vice chairman of quality. He's actively involved in teaching medical students and residents and has won various teaching awards. He used to practice in Burnaby, and he recently moved to the North Shore. With his unusual combination of knowledge and skills, he's been working toward developing a closer relationship between the laboratory community, primary care physicians, and patients. He's also one of the physician leads of the SharedCare Pathology Consult Service Project, which is the one that's hosting this for the Burnaby Division of Family Practice. So again, without further ado, I'll turn it over to Kathy, and then after Kathy does a bit of a presentation, you'll hear from Dr. Segal. Kathy?
Great, thank you, Jeff. So thank you very much for having me. I'm looking forward to telling you a little bit about the insides of LifeLabs and how it works and how it can make things better for you as a patient. So we'll go to the first slide. So LifeLabs Medical Laboratory Services is a Canadian-owned company that has been serving the healthcare needs of Canadians for more than 50 years. We're the largest lab in Canada and the 4th largest in the world. LifeLabs is in British Columbia, Ontario, and we have patient service centers located in Saskatoon and Regina, where the patient service centers collect the specimens and send them to the Saskatchewan Health Authority for testing. Today, LifeLabs performs more than 112 million lab tests every year, helping healthcare providers diagnose, treat, monitor, and prevent disease in patients using the latest technology. What does LifeLabs do? Patients visit LifeLabs to have their blood collected and tested, to have their urine samples tested, and to have cardiac monitoring tests done, such as ECGs, Holters, ambulatory blood pressure monitors. This is called diagnostic medicine. And what is diagnostic medicine? You probably want to know. We perform chemistry tests such as glucose levels, cholesterol, kidney function, liver function, and thyroid function. We perform hematology tests like CBCs, which is complete blood count, which can include hemoglobin, red cells, white cells, and a few other different things. We do heart tests, ECGs, also known as EKGs, Holter monitors, and blood pressure monitoring. We perform microbiology tests like throat swabs, urine cultures, stools for culture and sensitivity, ova and parasites, and insects like bed bugs, ticks, and lice. We do testing for naturopathic doctors. So if your naturopath wants you to get some blood work done, we can do that for the naturopathic doctor. Next. And we do genetic tests for patients who are interested in genetic testing, such as non-invasive prenatal testing, pharmacogenetics, breast cancer, and breast cancer hereditary and rare conditions. Access to your lab results is through MyCare Compass. MyCare Compass is a free, secure service brought to you by LifeLabs, offering more than just results. MyCare Compass reflects our new services designed to help you navigate your health. Here, with more than results, you can book your appointments, check in online, and eventually you'll be able to browse health articles, shop the marketplace, and many more exciting features to come. COVID and travel is through LifeLabs FlyClear. I work in the MSP side of things. So FlyClear is a private pay test. So that's a little bit of a different facet of LifeLabs. But you can go onto the FlyClear by LifeLabs website for more information, and it's for COVID testing for travelers. We provide mobile lab services. This is a free mobile lab service to patients in care facilities and private homes, but it must be deemed by their doctor to have mobility challenges on the patient. The service is provided free of charge. We don't bill MSP for this service, but if the patient is unable to go shopping or go to their doctor's appointment, this would meet the criteria, but they must be homebound because we do have limited resources for this. So we need to protect it for the patients who are not able to leave their house for tests. And the doctor orders that, they fax in the rec. Courier specimen pickup. We have our own courier department, which picks up the specimens collected at our patient service centers. We pick up microbiology specimens from some of the large clinics. So if you were to have a swab or a urine sample collected at your clinic and you didn't have to bring it into the patient service center, then we would be coming by the clinic to pick up those samples from your clinic so that you don't have to take it to the patient service center. So lab requisitions, they have your patient and healthcare provider information. It's very important to have this completed on the requisition. We need your first and last name, your date of birth, your personal health number, and your address and telephone number is also helpful to have, but we can obtain that when you're in for your visit. If it's a drop-off specimen, then it helps to have the correct address and phone number. So if we do need to contact you, we have that current up-to-date information on the requisition. One of the most important things on the requisition is your doctor's name and the clinic that they're working at. We need to know where to send those results. And if the doctor's name is there, but no address, and we ask you, a few years ago, we had a Dr. Wong who worked on Kingsway, and Kingsway is all in Burnaby and in Vancouver. So the patients would say, oh, well, it's the office by Metrotown. But Dr. Wong had 3 offices by Metrotown. So we really do need to know which clinic to send the results to make sure that we get the results there quickly for you. So this is what the standard outpatient laboratory requisition looks like. Sometimes it has LifeLabs, sometimes it has Fraser Health Authority, sometimes it has Vancouver Coastal. It's a standard outpatient laboratory requisition where you have all the patient information, the doctor's information, and then there's a bunch of tick boxes for the doctor to choose the test that they want. And then there's a little area down in the lower right-hand corner where they can add additional tests that might not be included on the requisition. So we have appointment centers and we have walk-in centers. This is fairly new since COVID because last year we transitioned some of the patient service centers to appointment centers due to the demand for appointments. Patients were having to wait 6 to 8 weeks to book an appointment, and they really wanted an appointment so they didn't have to stand in a lineup. With COVID, we couldn't have many patients sit in the waiting room, so patients were standing outside in the heat domes, Arctic outflows, the atmospheric rivers, and the swarms of murder hornets. By providing appointments, we were able to give patients an approximate time to go to the waiting room, and then they don't have to wait in all the weather challenges. Patients can book online at lifelabs.com by setting up an account or have a loved one book for them. I book for my family and I book for my Uncle Bruce, who is not familiar with computers. So I can have a list of patients that are friends and family that I book for. Or you can call our Client Information Center at 604-431-7206, and one of our agents will help you book an appointment. You just let them know when a good time is, what patient service center you want to go to, and they can help you. You might have to wait for a bit to get through to book the appointment, but it's better to wait in the comforts of your own home to book the appointment than it is to stand out in an atmospheric river. Walk-in centers allow patients to show up spontaneously. You will likely have to wait, but you don't require an appointment. There will be a lineup that you'll have to stand in. You can check the location finder at www.lifelabs.com for locations, hours of operation, and whether they require an appointment. So this is what it would look like on the location finder. You can see number 1 is Metrotown. You can book an appointment there. You can use Save My Spot, or you can just walk in. Whereas number 2 at Central Park, appointments are required. And you can book an appointment with that click link on just off to the right-hand side. Now on the skinny little yellow arrow, you can click on details and it will show you the Monday to Friday or Monday to Sunday hours of operation, whether they are open Monday, Saturday, Sunday. Click on the details and it will open up a new window for you. The big fat yellow arrow points to the appointments required, and that's what you want to look like. If it's look for, if it says appointments required, you need to book an appointment. We perform MSP billable tests and private pay tests. MSP tests could include glucose, kidney function, liver function, lipid profiles, or other tests pertaining to general health. Private pay tests could be drug screens for court, Department of Transportation, prenatal genetic testing, fecal calprotectin, which is sometimes covered by MSP. It just depends on the diagnosis. Human papillomavirus to test to assess risk of cervical cancer, And 24-hour blood pressure monitoring records the blood pressure in your daily life, or any other tests that do not meet the MSP guidelines, such as vitamin D or Pacific prostate antigen, prostate specific antigen.
That's great information, Kathy. This is fantastic. Much appreciated. Thanks so much to the Burnaby division for giving us this opportunity to come and speak to you. So what I wanted to do is just go over a little bit about what do laboratory physicians actually do, and hopefully we'll take some of your questions to, or actually I'll provide some answers to common questions, and then we'll hopefully have some time at the end of the presentation to answer some questions you might have as well. Let's go ahead and hit next slide. So I called this the black box. So what do we do in laboratory medicine? So what we do is we help doctors in the community provide better care for their patients. This includes chronic disease management, such as diseases like diabetes, chronic kidney disease, and heart failure. We also provide diagnostic testing to determine if you actually have a disease present or not. Next slide. So what I'm going to do is I'm going to just delve into a little bit more about the three main sections of the lab, describe some of the testing that's performed in each section. Some of this actually Kathy went over, and I might expand on it just a little bit and answer some common questions. Next slide. So the three main sections of the lab, you actually can see them in the lab requisition. At the top left of the requisition is the hematology section, which of course is the best because I oversee that one. The chemistry section is probably our most comprehensive section, and the hematology and chemistry tests are all run from Burnaby lab, Burnaby Reference Lab, which is really a stone's throw from Burnaby General Hospital. The microbiology testing is performed at our Surrey location, and we'll go into further detail about the different tests that micro has to offer. Next slide. So for hematology tests, so Kathy mentioned, we do a hematology panel or a complete CBC, complete blood count. That test, we'll explain that a little bit further, but we also do coagulation studies, and coag studies are measures of somebody's bleeding times. The two common tests that are run are prothrombin time and partial thromboplastin time. We also perform hemoglobin electrophoresis, which tests for genetic abnormalities in the actual hemoglobin molecule, as well as to detect if you have a reduction of certain chains that make up the hemoglobin molecule, resulting in disease processes known as thalassemias. You may have heard of that word, or that disease process. In addition, we also perform thrombophilia workup, and thrombophilia is a fancy Greek word which basically means like thrombus or like clot. So if somebody has a clot, like a clot in the lung or a clot in your leg, there are different laboratory tests that we run here at LifeLabs to help your doctor determine if you're at increased risk to develop further clotting. And that may help guide the doctor to treat the patient longer than typical usually. You may be on an anticoagulant for life, for example, if you have a genetic abnormality that leads you to clot more than a normal person. Next slide. Some of the chemistry tests include the workup of diabetes, gestational diabetes, thyroid disease, cholesterol profiles, electrolytes such as sodium and potassium, liver function studies, kidney function studies, tumor markers, pregnancy tests, autoimmune disease testing. These are just a very big, broad helicopter view of several. Next slide. The microbiology tests include tests looking for bloodstream infections, gastrointestinal infections, urinary tract infections, and wound infections. Again, these are just a very high level of what there is to offer. Next slide. So what I'd like to do is go over some common questions that you might have regarding certain types of tests. Next slide. So the first question is, what exactly is a hematology profile? And so what we're measuring for is we're measuring white blood cells in the blood. We're also measuring your hemoglobin and hematocrit and platelet count. And so what we're looking for white blood cells, these are the cells that that fight off infection. And there are different types of white blood cells. And what we do is a differential. And we basically show the doctor the types of white blood cells that occur in the body. And some examples of those white blood cells will be the neutrophil, the lymphocyte, the eosinophil, and the basophil. Furthermore, we also check on the health of our red blood cells, and we normally test that with a hemoglobin level and a hematocrit level. And the hemoglobin is basically a protein that helps carry oxygen to the body, and the hematocrit is a ratio of your red blood cells to the plasma. So if either of these are low, you're trying to pick up an anemia. So that means literally anemia is decreased hemoglobin and decreased hematocrit. Next slide. So that's what my blood counts mean. Go ahead and hit, if you could just advance that slide just so we get the question on the top. So when my blood protein level is elevated, should I be concerned? So proteins in the body can be elevated due to many different reasons. The elevation is typically most commonly due to a generalized inflammatory state, or it could be due to an autoimmune condition, an infection, a skin condition, or in worst case, a malignancy or a cancer. Proteins are measured by a laboratory test known as a protein electrophoresis, and that's where we use serum for that test. And that's also abbreviated as SPEP or SPEP. And what that test does is it basically separates proteins based on their size, and they're different. We won't need to go into the details, but just to let you know that that's what we're looking for, is different types of proteins and the different patterns that are associated on a protein electrophoresis. One other important thing to know with a protein electrophoresis is you want to know whether or not the elevated protein level is polyclonal, which means it's coming from multiple different lymphocytes, or monoclonal, which means it's coming from one lymphocyte. And you'll see I put that word plasma cell at the in the presentation. So a plasma cell is just a type of a lymphocyte. Lymphocytes are the cells that that secrete your antibodies, essentially. Okay. So what should I do when my INR goes up or goes down? So an INR is an international normalized ratio. So what that is, it's a ratio measuring how long it takes for blood to clot. And the INR needs to be monitored if you take anticoagulation or anticoagulants, specifically warfarin or Coumadin. And when your INR goes up, that means that your blood is thinner than it should be. So this can occur because you're taking a medication like warfarin. The most common disease states that somebody takes warfarin for include atrial fibrillation to prevent stroke. Also, Coumadin can be used as a treatment to prevent further clotting, such as a DVT or deep vein thrombosis, or a pulmonary embolism. Those are just a few examples of why somebody takes a blood thinner. Your doctor will guide you on the dose of the warfarin depending on your level of INR. So if your INR is too high, you may need to increase your consumption of vitamin K rich foods, such as green leafy vegetables, to reduce the INR back to its normal state. Or it's very important to know that if your INR is high and you notice bleeding, that is a more serious problem and you may need to go to the emergency room. We actually have an on-call service here at LifeLabs, and one of our responsibilities as a laboratory physician is to phone out critical results. So you actually might hear from me. Hopefully not. But in case you do, that's why. We're just trying to make sure that, that the patients are safe. Next slide. So my creatinine is high. Do I have kidney disease? So this is a very common question. So what exactly is creatinine? So creatinine is a muscle waste product that is easily measured in the blood. It's basically completely filtered and not reabsorbed by the kidney. So therefore, it's a great measure of how the kidney is handling waste products. So the GFR stands for glomerular filtration rate. And what the glomerulus is basically the functional unit of the kidney itself. And your kidney has thousands of these glomeruli within it. So the GFR is calculated based on someone's age, sex, and body surface area. It's a very complicated equation, which we don't need to go into details. You just need to know that when the doctor is testing your kidney function, they're looking at two things. One is the creatinine level, and the other is the GFR, or the glomerular filtration rate. Next slide. So do I have kidney disease? So GFR is measured in milliliters per minute. The normal GFR is anything above 60. But it's important to know that if your GFR is a little bit less than 60 and you're older, you might just have a slightly reduced GFR based on your age. That doesn't necessarily mean you have a disease process going on. The key issue with kidney function is you have to trend the kidney function. So you need to monitor, the doctor monitors changes over time in the kidney function. So those changes are important, because if there's a quick change from a high number to a lower number, that could mean you have a more serious problem, or acute kidney injury is what we like to call it in medicine. Doctors will also monitor your urinary protein concentration, and that's typically a marker for disease progression in diseases such as diabetes or high blood pressure. A lot of times your primary care provider will add a urinary protein concentration level to determine if that disease process, diabetes or hypertension most commonly, is causing damage to the kidney. And that's a marker that will let the doctor and patient know if your kidney is being damaged by those diseases. Next slide. Go ahead and hit next again for the, there we go. So why is my potassium elevated? So your potassium is one of the electrolytes that's really important to measure, because it tells us kind of how your body is handling salt and how cells are communicating with one another, including neurons, heart, kidney, all sorts of organs in the body utilize electrolytes. So your doctor is checking to see if your potassium is elevated or low. But one of the most common reasons why a potassium is elevated is because sometimes potassium moves out of the cells during a blood draw. And this can occur for many different reasons. One is a prolonged tourniquet time. And that prolonged tourniquet time can typically, just from the actual blood draw itself, can actually cause splitting of the red cells, and that splitting of the red cells releases potassium into the blood, and that will falsely elevate your potassium level. Similarly, if you have trauma during the actual venipuncture, that can also raise your potassium level. Most of these scenarios are actually not pathologic, or not meaning that a disease process is not occurring. All that means is that your level is elevated and probably needs to be rechecked. Most of the time, when that elevation is rechecked, it normalizes just on its own. Kidney disease is the most common reason why potassium level comes back and it's elevated. So if your potassium level is elevated, just have a conversation with your physician about potentially why that is. And you may need to come visit us again, and we'll be happy to see you. Next slide. So my ANA is positive. Do I have lupus? So this is a very good question, because ANA testing is very common. It's usually done to rule in or rule out rheumatologic diseases or diseases where your body actually attacks itself. And one of the most common tests we do is an ANA, which actually stands for an anti-nuclear antibody. And what these are antibodies that bind to the nucleus of a cell, and it's detected by immunofluorescence under a microscope. Now, ANAs are typically measured in titers, and you'll see in the diagram here, you can either have a low positive titer, which is a 1 to 40 measurement. That 1 to 40 means that your sample the blood is actually diluted 40 times. Or you can have a test where it's a higher dilution, which is 1 to 160. And if your ANA is positive at 1 to 160, that means that the immunofluorescence is actually detected at a higher concentration because it takes longer for that to dilute out. It's a little confusing and counterintuitive, but just remember that if you have a positive ANA, a low positive is 1 to 40, and a high positive is typically 1 to 60 or even higher than that. This ANA test is a useful tool to provide additional evidence to a doctor that the patient has autoantibodies which support an autoimmune diagnosis. And these autoimmune diagnoses could be rheumatoid arthritis, systemic lupus is another example, Sjogren's syndrome is another example, and the list goes on. Next slide. Like I said, it's very common to have a positive ANA, but the higher the titer is, the more likely you actually have a disease. So if somebody has a low positive, a 1 to 40, and they actually feel fine, the chance that they have something brewing, an actual disease process, is really low. So a positive ANA in the absence of clinical signs or symptoms at a low titer usually does not mean disease is actually present. So again, if you're not sure, talk to your doctor about what the test means. Next slide. So are there any medicines that you should avoid for your test? And to be honest, this is a lecture on its own because there are lots of different medicines that interact, but a few common interactions that occur are one is for fecal calprotectin testing, which is a screening tool used for inflammatory bowel disease. And common medications such as that you take for pain, such as Advil or Aleve, should be avoided for 2 weeks at least before you undergo a fecal calprotectin test, because falsely high levels can occur. Treatment for Helicobacter pylori, which is an infection in the abdomen in your stomach, can also affect results of this test. So we like patients to actually not have started treatment before they undergo this type of test. And that test can be done 2 ways. One is a breath test and the other is in the stool. All right, let's see. Okay, so anticoagulants. So blood thinners, sorry, I'm almost there. Blood thinners should also be stopped prior to lupus anticoagulant testing. So because anticoagulants can interfere with lupus anticoagulant testing. And if you'll remember a few slides back, lupus anticoagulant is one of the risk factors for thrombophilia, or somebody who is likely more prone to have a stroke or a clot, basically. So if your doctor orders a lupus anticoagulant, just make sure you're off of your blood thinner. So that's just another caution. So please ask your doctor to advise which drugs should be stopped prior to your laboratory visit. That's also very important. And I'll be happy to take any questions that anyone happens to have. Thanks again for your attention.
Great. Thanks, Dr. Segal, and thanks, Kathy. There is an awful lot there. And I know we already have some questions. If others have questions, you can certainly put them in the chat and we'll start to get to them. I think one of the things that I was thinking as I heard this is, now that we can essentially access our lab results online, and we have the internet, it feels like we have just enough information to be really dangerous. Is there something that we should be telling people about what they should do when they see their results? I mean, you gave some good background as to what those results might mean, but what's a sort of that, because I think we're all kind of online going, hey, I can see this, and it's like, wow, what? And I go on the internet, oh my God, I'm dying. So
that's right. Yeah. So the first thing is a great question. The first thing is that you should never panic, because typically, if the labs match the disease most often. Okay, so if you have horrible laboratory values, your body will let you know. So, for example, if you have terrible kidney disease, you will know, because you'll have fluid. So what the kidney does is the kidney gets rid of fluid, right? And if your kidneys aren't working, you'll develop lower extremity swelling, you'll develop fluid in the lungs, you'll have difficulty breathing. So if you have those signs or symptoms, yes, you should be concerned. But if you feel completely fine, and you notice, this is the key, you notice that your laboratory abnormality is just a little bit outside the normal range, do not panic at all. It's just probably, there may or may not be something going on, but you just need to talk to your doctor about it. But the internet is good, but it's also a little bit dangerous, because like you say, Jeff, that you get people start wondering, is there really something serious going on? And most commonly there isn't. But just talk to your doctor just to be on the safe side, just for reassurance.
Yeah, and I guess that, when you talk about that, going on the internet and seeing what I might have might make me feel like I have it. I might be able to make those symptoms up pretty quickly if I need to, sort of thing. So that idea of being, connecting with your doctor, and I guess the reassurance that you sort of, if there were a result that had a significant implication, either your doctor or a lab doctor would be in touch with you.
That's right. That's a safety net that the province actually has entrusted the laboratory physicians with. So if there's a critical value, let's say you're short of breath, let's say, okay, and it's because you may be bleeding inside and you're not sure, and your doctor's ordered the test, but our client information center gets the critical value, and they try calling your doctor, but you can't get a hold of your doctor for whatever reason, that call comes to us, and we'll actually call the patient ourselves, and we'll have a conversation. And usually we tell the patients that it's a critical value and they have to go to the hospital to get it rechecked and treated, for that matter. Yeah.
Yeah, and I think, and that's the other part. I mean, I guess there's always that, you say recheck. If a test shows something in particular, the likelihood is you're going to be retested to ensure that the result was accurate.
That's right. That's very common. Yeah.
Yeah. Is it common that that those retests show different results? I mean, obviously it's dependent on
that can happen. So laboratory errors happen. And typically what that refers to, so the most interesting you mentioned that. So the most common times when laboratory errors occur, it's actually pre-analytical, which means before the sample actually gets to the lab, or post-analytical. On the pre-analytical side, specimen mislabeling, or maybe it was in the wrong tube, or maybe it sat out for too long. Going back to that potassium issue I raised, so we have specimens that come into us from trail, which is several hours away. And when that happens, your potassium level goes through the roof. Your glucose level will actually decrease because the cells that are in there are chewing up all the glucose to stay alive, okay? To have the machinery working, so your glucose level will go down. That, again, the numbers will look terrible, but the patient's fine. You see what I mean?
So it's the sample that has changed, not the patient.
The sample,
it's no longer accurate. And I guess when patients are collecting their own samples, particularly fecal or urine, there's always the risk that it might be mishandled at that point as well.
That's correct. But again, there's no need to panic. We just may need to recall you to have a retest. And that's, we do that all the time. Yeah.
Great. Kathy, I think this one might be for you, and you may have mentioned it, but I'll just reiterate it. How long will it take for the doctor to get test results generally?
Generally, the tests are done same day. So most of the general high volume chemistry is reported out that night. The hematology is reported out same day. But there are some specific tests that are a little done less frequently. Sometimes they're done over in our testing facility on Vancouver Island. So, and sometimes the turnaround time is they're only tested a couple of times a week. So the turnaround time for those tests will be longer. There's also fungal testing, which can take up to 30 days to be reported. So there's various tests. The most of the routine tests are done and reported out same day, but don't always panic just because you haven't received your result or your doctor hasn't received the result, but you can certainly call in to check because sometimes tests are not added when they should have been. And so if you do call in, there's some thyroid testing that we hold on to. If the test wasn't added on, we can add it on. We hold the serum for 3 days, so we can do the testing if it was missed, but chances are it's just a matter of the turnaround time if it's an unusual test.
That's interesting. You bring an interesting point up there, though. Basically what you're saying is if the doctor has ticked off X number of boxes to test that blood with, and there's a determination you might want to test something else afterward, there might be a possibility of doing that because you hold on to that sample.
Yeah. And we do have doctors call in, so they get results back and they go, oh, okay, that's not what I expected. I want to run a couple of other tests in addition to, so they can call in the next day or the day after and add on. The doctors can, not the patients, but they can add on additional tests. Also, some of our testing is sent out to hospitals as well, and BC Centre for Disease Control, and we don't have any. We don't oversee that, so those test results might take a bit longer as well.
It's good to know that I don't have to go, if the doctor decides I need more tests, I don't have to immediately go in and get jabbed again. They can actually use what they've already got. That's great to hear. Just in terms of it comes up with another question for me. I'm kind of on this thing of looking, because I have aging parents and an aging person, so I look at lab results an awful lot online. Do I get them at the same time as my doctor, or does my doctor see them first?
No, you get them at the same time as your doctor. It's all done electronically. And some of the messages are actually for the doctor. It's not for you to call so if one of the tests is sent out to BC Centre for Disease Control, you will see that if you want to contact BC Centre for Disease Control, then you need to add on or call this number. Sorry, I don't know where that's coming from, but I'm
glad it's not the ringing in my ears. Yeah. I'm happy about.
So you can, you will see the message for the doctor, but it doesn't mean that you need to call BC Centre for Disease Control to get that information. You cannot. So you will see exactly what the doctor sees at the same time the doctor sees it.
Right. And this kind of goes to a question, I think maybe this is one for Dr. Segal. You mentioned, that if there's this mechanism in place where lab doctors will call patients. Can patients, does it work the other way? Can I, as a patient, get in touch with a doctor at the lab?
So no. It's difficult to do that. Typically that's not what happens, but what we're trying to do is we're changing the way sort of we're doing business, and we'd like to have the patient take control over their own health. And in support of that, we as laboratory physicians will hopefully make ourselves available to have a consult with the patient directly, but that's not yet in place.
Right. So that makes sense. So don't call you, essentially. Yeah.
For now.
Not yet.
Not yet. But it's coming. It's coming soon.
Good to know. So this is a little bit more clinical question. What about liver enzymes? And then this person says they remember they've had several tests and the enzymes were high, but the doctor kept saying it was okay. And later on, the ultrasound showed a little bit of SACR, which I don't know what that is, and I was diagnosed with fatty liver. Which is asking why the doctor may have thought it was okay before.
Yeah, so liver enzyme elevations can occur for lots of different reasons. One of the most common is fatty liver disease, and so that a doctor, let's say if you go to your doctor's office and you have some blood work done as part of just your usual annual health check, and the doctor notices that the elevations are slightly higher than in the normal range, that doesn't necessarily mean that there's horrible disease going on and you're dying. What that means is that the liver is just not as healthy as it should be. And one of the most common reasons is there is excess fat in the liver, and that shows up with an enzyme elevation that is typically just outside the reference range. It's not as if you're having elevations of liver enzymes that are in the thousands, such as like an acute hepatitis or acute liver infection from hepatitis A or hepatitis B, for instance.
And I mean, I guess that kind of goes to, I guess the other point of is, for some things, some people just have, although we have these parameters, some people normally fall on one end or the other end of the given parameters. Is that true?
Yeah, it depends on what's happening with their disease state. So I see patients in the community as well, and I have lots of people who are pre-diabetic, okay, which means their hemoglobin A1C is not in the diabetic range, but it's almost there. So the cutoff for diabetes is 6.5, for instance, okay? A lot of patients will live at 6.1. We usually don't treat them at that stage, but their normal physiology and their ability to handle sugar is at that level, and they do live there. Yeah,
that's normal for them at that time.
Normal for them at that time, correct.
Yeah, got it. This is a question around how often can a doctor order blood tests? And in fact, someone else has mentioned that the doctor asked for a retest in 3 months, but the LifeLabs said that MSP wouldn't pay for a retest that quickly, so they wouldn't perform the test. Is that a usual thing, or?
So yeah, so I mean, they're very strict guidelines on how, strict clinical guidelines on how often these tests should be done. So what we do is another facet of our job is what's called laboratory utilization. So we try to reduce wastage in the system. So Kathy mentioned thyroid testing, right? And the thyroid protocols that we have. So if your thyroid function has been normal for, let's say, the last year, and you haven't really noticed a change, there hasn't been a change in your medication, for example, let's say if you're taking replacement, there's really no need to retest as frequent. Because if you look back at the values, they've been fine. So this idea of standing orders, quote unquote, that actually leads to a lot of over testing, because there happens to be lots of clinical scenarios where a patient will be fine for the entire year, and if you tested them, maybe once or twice in that year, it would be adequate. So
is there a risk? Is there a risk in over testing? There's an expense.
It's just expense. There's no risk. The only risk is that the risk of a blood draw, which is, it's minimal, right?
Sure.
But there's no health risk associated with it. It's definitely more of a monetary budget issue, because LifeLabs has a certain finite amount of money to take care of the province, and we can't waste money, essentially.
So that goes to, and I think Kathy, maybe these ones are directed at you around sort of private testing or pay as you go. There are some tests that simply aren't covered by MSP, whether it's vitamin D or PSA. Do you need a referral, a physician referral for those tests, or can I come in and get those and ask for those tests and pay for them?
We require a physician referral. Even if it's private pay, it has to come from a doctor, because we have to provide the results to the doctor to review with the patient. So the patient still needs to go in and get the requisition for those tests, and the doctor should indicate private pay on the test, on the requisition.
So, I mean, really what that comes down to, if I feel like I need a specific test, but my doctor doesn't agree, I either need to wait or find another doctor, I guess.
Yes.
Yeah. But those are my choices. But that's obvious. This kind of goes back to don't make decisions on your own. There's a reason for that, because the doctor will consider whether it's actually clinically necessary or appropriate. So this is you may have, I think you touched on this, Dr. Segal, but there's a question around cancer screening blood work, and how extensive is that, and is there a way that you can, the question is actually what are cancer screening blood work, but there's obviously quite a broad range.
Yeah, so this is a little tricky subject, because there are debates in the literature about this, about how often somebody should have, screening testing done for certain cancers. PSA, like we're on the subject, that's a common one that typically this is kind of patient dependent. Okay. Again, it has to do with a discussion between your doctor and the patient. But a lot of other tumor markers, such as for pancreatic cancer or ovarian cancer, these markers should not be used for screening purposes. Okay. Because what that does is, if they're slightly a little bit abnormal, then the doctor will sometimes chase that value unnecessarily. Okay, the biochemistry of these tests are a little bit tricky, and they can lead to false positives a lot of the time. And so we have to be wary. The way those markers are specifically used is in patients who have a known diagnosis, undergoing treatment, and then they're being followed for recurrence, if that makes sense. Okay, so those tumor markers are really ideally used in the setting where you have a known diagnosis, you're being treated, and the doctor wants to know if any evidence of cancer is there, and they use those markers at that stage, not a screening test.
Right.
But we do screening for things like FIT testing for stool, for blood in the stool, prostate specific antigen, like you mentioned. Those are the common ones that we do. But for a test like for breast cancer, you don't show up to LifeLabs. This is not a good use, right? You don't show up to LifeLabs and say, "Oh, please test my blood for breast cancer." You see what I mean? Typically, you have a known diagnosis, you're being treated, and then the doctor will check your CA 15-3 to see if there's any evidence of recurrence.
Or you may have indicators that say we want to go check further to see what to find out if there is cancer involved.
Right.
Got it. Great. This is another one. This is actually a technical one, I think, for you, Kathy. This is someone's asking, why can't I get my Holter results? I'm not sure, but I'm wondering if they're saying those might not be available online.
They are available online. I actually checked with our cardiac manager, and she said the actual reporting, the interpretation, and the diary is all available online. So you just have to sign up for MyCare Compass, and you can get those results online.
That's good to know. Yeah, and I was about to ask, well, does it mean anything to me? But if you're saying that the interpretation is there as well, then there's the opportunity for that.
Yes.
Another good question just around that, we just have a few minutes left, is what about language and interpretation? Is there support at LifeLabs around that at all? Interpretation of results or actual different languages, or is there a way that a place that you can point patients to get that kind of help?
We point the patients back to their doctor to discuss the results with their doctor. And if the doctor has any questions, they can contact one of our medical scientific team for a consult to discuss any questions they might have.
And I probably wasn't really clear on that. I just wondered about interpretation, actual language interpretation. Because we have such a diverse population, I wonder if you come up against that. And I know that folks, they're looking for, everybody's looking for the knowledge, but the language can be a barrier. Is there? Do you know if there are supports for that in the community at all?
Not to my knowledge.
Okay, no, that's great. I mean, maybe it's something that we need to look at being able to support. So I think there's one. I'll give the last question to Dr. Segal, because it just seems like When should I call my doctor?
I mean, when it comes to lab testing, I mean, you know, you should, first of all, if you're not feeling well, you definitely need to talk to your doctor, okay? But even if you are feeling well, I think it's always good to, you know, to just go have a conversation. If you haven't had lab work checked for several years, I think that's not really the best idea. I think, you know, it's just kind of, in general, it's good to know, you know, how your internal organs are functioning, you know, because something might be brewing that you don't know about. And, you know, we have lots of data and we can provide that data to the doctor and patient. And I think it's very valuable information. Early detection is always good for everything. And that's where we specialize in, is early detection, early disease diagnosis. So
Don't wait. Don't wait. If you worry, don't wait.
That's
Perfect.
right.
Don't start with the internet and leave it at that.
Right.
Great. Well, this has been wonderful. Thank you, Kathy. Thank you, Dr. Segal. It's just, I know that, you know, that just from the questions and the folks on the line, it's been incredibly valuable. There are a couple more questions, a few more questions, so we'll make sure that we answer those when we do publish them. And again, for folks, go to the burnabypcn.ca website. This recording will be there, and we'll make sure that any questions that weren't answered are included. And again, I just want to thank you and really appreciate everybody's time. Have a wonderful Friday afternoon, and hopefully we'll get some sun this weekend. So.
Thanks, Jeff.
Thanks again, everybody.
Thank you very much.